Director Chief William Swan of the Office of Emergency Management, the Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Today we enter the second week of our modified Phase 2, which began on Monday, July the 16th, as a direct response to a dangerous spike in COVID-19 cases in Davidson County. Now, COVID-19 cases are rising at an alarming rate in 41 states and territories, including Tennessee. Hospitals across the South, the hardest hit region in the country, have reported shortages of vital healthcare resources, including ICU beds and medications. Our neighbors in Kentucky have fared better than other states in the region, including our own, but new cases and positivity rates there are on the rise, and Kentucky residents believe that compliance with their statewide mask mandate can prevent a reversal of their reopening plans. Now, on Sunday, Florida reported a new single-day record high of nearly 15,300 confirmed cases, widely reported as a global high for a day. Now, that was roughly 71 out of every 100,000 Florida residents. But here in Nashville, today's case count of 771, a record for our city, is at a much higher per capita rate of 111 per 100,000 residents. The numbers we are seeing make it clear that we will not be able to leave our modified Phase 2, including our restrictions on public gathering size and bars. We need to flatten the curve, and that will require compliance with health protocols. Tennessee's Department of Health is also reporting a record number of cases today at more than 3,300. More than a dozen cities and states currently restrict travelers from Tennessee due to our rate of COVID-19 infections compared to theirs. This includes Chicago, Alaska, Connecticut, Hawaii, Maine, Massachusetts, New Hampshire, New Jersey, New Mexico, New York, Pennsylvania, Rhode Island, and Vermont. These travel restrictions placed on us by other states is something we need to be aware of as our families make any summer plans. As of this morning, 20 states, including our neighbors in Arkansas, Mississippi, Alabama, and North Carolina, are either pausing or reversing their reopening plans. We are beginning also to see a need for states and local governments to ration their healthcare resources. Elective procedures have now been suspended across Mississippi, over 100 counties in Texas, and in many hospitals across Alabama, Florida, Nevada, and South Carolina. Bars continue to be cited as a major source of coronavirus spread nationwide and have now been closed in 10 states. Bars in Las Vegas, Nevada closed on July the 10th, and California announced yesterday that all indoor dining in bars will be closed to stem the tide of a statewide coronavirus resurgence. Now, our 14-day case average continues to rise and is currently at 335. Our positivity rate is 19.5%, meaning 1 out of every 5 Nashvillians who receive a COVID-19 diagnostic test is positive. Before our most current spike in cases, our positivity rate remained at approximately 10%. Our local hospitals currently have 25% of ICU beds and 24% of floor beds available, which meets or exceeds our target of 20% for each of these metrics. Dr. Jahangir will discuss our COVID-19 data in more detail momentarily. Now, as we heard from Vanderbilt ICU nurse Cody Hamilton last week, the coronavirus does not discriminate and is causing the sickest patients that our frontline providers have ever seen, including among young people. A recent report by UCSF shows that while patients over 65 are significantly more likely to be hospitalized than younger people, that gap is quickly narrowing. Between April and June, hospitalizations among young adults have increased by nearly 300%, outpacing the hospitalizations among older adults. And this trend is reflected here in Davidson County. As we mentioned last week, since our recent surge in cases began on June 15th, all age groups below 25 have seen an increase in infection rates. Survival is not guaranteed, and long-term effects of the disease are devastating. including limited lung capacity psychiatric issues such as post-traumatic stress disorder due to the trauma of the illness and the treatment, and kidney complications which could require long-term dialysis. Both epidemiological data and case reports demonstrate that masks and other face coverings are key to slowing the spread of the virus. In countries where mask mandates have been in place for some time, COVID-19 cases have significantly decreased, and a new sense of normal has returned to communities worldwide. For example, South Korea, a nation of roughly 52 million people, was able to flatten the curve of the virus even without a countrywide lockdown, thanks in large part to the widespread use of face coverings. Over the weekend, health authorities in South Korea have reported approximately just 60 to 70 new cases per day, which that country is able to consider an alarming spike in confirmed cases. In South Korea, only 2 deaths have been reported since July the 9th. Nashville has reported 2 deaths over just the past 24 hours. The loss of these individuals is tragic, and we extend our deepest sympathy to their loved ones. Germany, home of Europe's largest economy, once had one of the largest number of COVID-19 cases. In July, the number of new cases has remained below 500 a day nationwide, and Germans have widely followed the findings of a recent German study reporting that face coverings help reduce the daily growth of reported coronavirus infections by around 40%. Mask usage throughout the country is both required and has been widely adopted. Now, as of yesterday, 10 new cases were reported throughout all of Ireland. In Finland, 4 new cases throughout the entire country. Norway reported no new cases yesterday. In all of these examples, federal and local coordination on testing, contact tracing, and policy making have played a critical role in flattening the curve of the coronavirus. But masks and other face coverings, even among populations where they're not ingrained in local customs and culture, have also been a key element in reducing the spread of the disease. Cities and counties throughout the Southeast have identified the important role of masks in slowing the spread of the virus, and now require masks in public places and businesses, including Kentucky, Virginia, North Carolina, Georgia, and Mississippi. Here in Tennessee, 13 cities and counties now have a local mask ordinance in place. Metro Public Health has distributed over 240,000 masks to Davidson County residents and will continue to hand out its stockpile of masks directly and through our community partners. Don't share your air, Nashville. Remember, always wear a mask or face covering, whether it's manufactured or homemade, whenever you are out in public places and especially when encountering the 3 C's: closed spaces, crowded places, and close contact settings. Now, as mentioned earlier last week, enrollment for the Paycheck Protection Program reopened on July the 6th. The PPP is a valuable lifeline for businesses of all sizes during this time of historic challenge that has provided loans to more than 1,900 Nashville businesses. This morning, I want to welcome LaTanya Channel, Deputy State Director of the Small Business Administration, who is with us to discuss the details of the Paycheck Protection Program and how your business and employees can benefit from applying. Starting tomorrow, July 15th, all 3 community assessment centers in Nashville will shift their hours of operation to protect our assessment center workers and volunteers from extreme heat and humidity. This change will also provide Davidson County residents with more opportunities to receive a test outside of normal business hours. The community assessment centers will open at 7 a.m. and they will close at 1 p.m. Monday through Friday. If you get in line for a test by 1 p.m., you will receive a test that day. Remember, your efforts will determine our public health outcomes. Remember that. Your efforts will determine our public health outcomes. Please wear face coverings in public places, maintain a safe social distance from others, and frequently wash your hands to keep yourself and others safe. And I'll now turn it over to Dr. Alex Jehangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here's the latest on coronavirus in Davidson County. We now have 15,456 confirmed cases. That's 2,031 new cases since our update last Thursday. There are currently 5,436 active cases in Nashville. That's up 857 since Thursday. 65% of all cases, or 9,500 residents, have recovered and cleared the virus. Since our update on Thursday, 11 Nashvillians have died of COVID-19. 140 Nashvillians have now died as a result of this virus. The mortality rate for our city stays at 1%. The 14-day average of new cases continues to increase. This morning, the average is 335. That's up 38 more cases from our update last week. Hospital capacity this morning, 26% of ICU beds and 28% of floor beds are available for patients. 199 people are currently hospitalized in Nashville hospitals with COVID-19. Overall, more than 127,000 Nashvillians have been tested, and 12% of all these tests have been positive. Last week, 14,816 Nashvillians were tested, and 18% of those tests were positive. Since opening in late March, the community assessment centers have conducted nearly 50,000 tests, 9,800 of which were just last week. The three community assessment centers are open until 3 p.m. today. But as the mayor noted, due to hot weather, we are adjusting the hours. Starting tomorrow, the assessment centers will be open from 7 a.m. to 1 p.m. This will be better for those waiting to get tested and for those who are working and volunteering at our sites. The 3 sites are at Nissan Stadium, at Meharry Medical College, and at the Kmart in Antioch. Again, starting tomorrow, the assessment centers will be open from 7 a.m. to 1 p.m. 7 a.m. to 1 p.m. because of the heat. If you are in line by 1 p.m., you will receive your test. And our assessment hotline is open today and every day from 7 a.m. to 7 p.m. Please call 615-862-7777 if you have any concerns about this virus. Now, we have been urging you to wear a mask when you go out, and many of you are doing this, and I thank you for that. But this has been going on for months, and for those of you who are not wearing a mask, here are the things I need you to know. Cases are on the rise. They are going up dramatically in this city, in the state, and in many other states like Arizona, Florida, California, and Texas. Nashville has moved back from phase 3 to phase 2, and we will be staying in this phase for the foreseeable future. The Public Health Department has ordered everyone to wear a mask in public spaces. Masks can slow the spread of this virus. They can help protect you and your friends and family. And if those facts don't convince you, then think about this. Think about the economy. Failing to take precautions like wearing a mask puts our economy at risk. The faster we get this virus under control, the faster we can open our economy. Just last week, Goldman Sachs released a report that showed the impact of wearing masks. It showed that if we do not wear masks and the virus continues to spread, the United States GDP would decrease by 5%. That is $1 trillion. This isn't about politics. This isn't about young or old. This is about our health. It's about our safety, and it's about our economic future. Again, what works is wearing masks. It will slow the spread of this virus, and the way our numbers are going, that really is what we need right now. So wear a mask, practice social distancing, and wash your hands. I now would like to introduce LaTanya Campbell, Deputy State Director of the Small Business Association.
Good morning, Nashville. I hope everyone can hear me okay. I want to thank the mayor for having me join today. I just want to mention really quickly that our office, the SBA office of Tennessee, is actually located here in Nashville. However, me and my staff, we have been teleworking since the first stay-at-home order was issued in Davidson County. But that does not mean that we're not available to assist and receive your phone calls and emails. And I'll make sure at the end of my remarks I provide you those phone numbers so you can reach me and my team. As the mayor has mentioned, the PPP program, which some call the Payroll Protection Program or the Paycheck Protection Program, was a bipartisan piece of legislation to get help to small businesses around the country that have been impacted by COVID-19. And as already mentioned by the mayor, I'm happy to report that as of Saturday, July 4th, Congress extended the PPP program to August the 8th. Here's what that means. That means that a small business has until August 8th, if not sooner, to find a PPP lender here locally, anywhere around the state or even out of state, to get their loan submitted to that lender so that lender can get it approved by our SBA headquarters. As I mentioned, me and my staff are here in Davidson County. I'm actually a resident of Davidson County, and I want to make sure in my remarks that small businesses understand how the process works for PPP. So real quickly, as of June 30th, there was some data that was released on the PPP loan program that came out of Washington, out of the SBA headquarters office. And I do want to note that in the state of Tennessee, there were about 93,000 loans at the total of $8.9 billion in PPP. I want to make it absolutely clear that as a small business owner, you have to apply to a lender. Please know that before the PPP program, we had about a couple of hundred SBA lenders around the state. We knew them by first name. We knew where their offices were. And over the last 3 years, we've had a Tennessee Small Business Lenders Conference right here in Nashville that me and my team started about 3 years ago. With PPP, this allowed multiple other lenders to become SBA lenders for the purpose of PPP. So what that means practically for me, I don't necessarily know them by name like I know my normal SBA lenders. But that does not mean I don't know who they are, and you know who they are as well. I want to remind our small business owners here in Davidson County that there are several ways that you can find a PPP lender. You can go to sba.gov/PPP. There you will find a list of all the lenders in the state of Tennessee that have already done PPP and are continuing. You can also go to www.treasury.gov. From that site, you can enter your zip code, and you can find a lender near you that you can reach out to apply for a PPP loan. I also want to mention that we have an SBA website called Lender Match. So if you go to sba.gov and go to Lender Match, you fill in some basic information, your name, the name of your business, where it's located, and from there you can be matched up with a lender who's going to find you. And if that lender is doing PPP, they will reach out to you directly. But I want you to take the first route, finding a lender yourself. But please know that Lender Match is an option. I also want to mention that with some legislative changes that occurred since PPP started, there are some non-traditional, non-bank lenders that are doing PPP. You've probably heard about CDFIs in the news. I'll just mention a couple here in Tennessee that have been taking PPP applications. One is BrightBridge, which is one of our traditional SBA lenders. They're doing statewide lending. Another is Tri-State Bank of Memphis. It sounds like a bank, but it's actually a CDFI, which is a non-traditional bank lender that's doing PPP. Another first with PPP are lenders that we traditionally don't associate with small business lending, the fintech companies. So PayPal, Square, and Cabbage also signed on to do PPP loans. So if anything, I want you to have multiple ways where you can find a lender. You can also call my office, and we can help you navigate all those tools in finding a lender. And please know if you're struggling, if you're reaching out to someone and they're saying, hey, we're not doing PP anymore, or it seems as if the application process is a little more onerous than it should be, give our office a call, and me and my staff can help you with both. I also want to give a quick reminder on how the PPP process works. In this instance, as well as for regular SBA loans, it is a lender decision on the actual loan. SBA is the guarantor, which simply means that SBA is providing the money and the backing for those loans to be issued. Those applications do not come to my office, and neither does anyone on my staff review those applications. Those applications get submitted to a lender, and then SBA headquarters out of Washington, D.C. will approve that loan for that lender to then let you know that it's been approved and SBA is going to back it up. I also want to mention that throughout the PPP process, there have been a lot of changes, and you've probably heard it in the news a lot, almost every single day. And one of the changes that did occur midway through the process was that our SBA headquarters is now going to automatically review those PPP loans that are greater than $2 million. That was done in an effort to be sure that the smallest of the small businesses were actually getting access to these loans, and those businesses that should not were not getting access to the loans. You probably heard some things in the news very, very early on. So again, as a reminder, what my office can help with. My office can help you navigate finding a lender. We've also been doing workshops and trainings and hosting office hours since March to help match up businesses and find lenders and to navigate the process. We've also been working with local chambers and organizations to help get the word out, including the Metro BAO office as well, where we've done several webinars and trainings. One other thing I want to mention is that in June, there were some changes to the PPP program in a piece of legislation. Once again, it was bipartisan support to make the PP loan a little bit more flexible. And some of those changes, including extending it to 24 weeks when you have to pay payroll as opposed to 8 weeks. Another major change that came out of the Payroll Protection Program Flexibility Act was that you can now spend those loan funds. 60% has to go to payroll as opposed to 75%. There's also a continued loan deferment. You still have 10 months to start even paying back that loan. You don't have to start immediately paying back if it becomes a loan. Please remember, the fundamental purpose is to pay your payroll. You have to spend those loan funds on payroll. There's a designated list of items that are non-payroll that you have to spend it on, and then that loan can be forgiven completely, and you'll never have a payment. If that loan continues to remain a loan, please remember that's 1% interest, and those payments probably won't begin until October of 2021. And we can help you navigate that process and understand that. I also want to finally mention that on the forgiveness side, if you get a PPP loan, there is a forgiveness form that has to be completed and submitted to your lender. That lender has to then submit it to SBA, which again goes to Washington, D.C. headquarters for the forgiveness process. And then finally, please remember that there is another loan option out there. It's called the EIDL, E-I-D-L, Economic Injury Disaster Loan for COVID-19 and those businesses impacted by that. And that is an Sba Direct Loan. You don't have to go to a lender. The decisions, once again, are not made here locally in Davidson County or Nashville or even in Tennessee. You do have to go to SBA's Office of Disaster Assistance. But again, if you call our office here locally, we can help you navigate that as well. So let me just conclude by giving you the local number to the SBA Tennessee District Office, which is 615-736-5881. I have a staff of 9. We cover the entire state, and that phone should be answered between 8 and 4:30. Please know that we're working around the clock. We're still handling emails, in the midnight hour, and we're returning phone calls outside of those business hours. But if you call 615-736-5881, you should get a human being, a live person, in my office that can answer your questions and help you navigate both PPP and the other loan programs to hopefully help you recover.
Thank you, Ms. Channel. We'll now begin taking media questions, beginning with Ian Jung at the Tennessean.
Good morning. I believe Mayor Cooper mentioned a 19.5 positive rate. Can you clarify what that rate is related to? He said that numbers show we can't leave modified phase 2, but don't the numbers show we should revert further? I mean, what does the city want to see or need to see in order to trigger regression? Secondly, can you share details on the city's ability to timely investigate cases? I know on our dashboard, the public health capacity metric is green, but Metro's goal, which was listed back in March or April, is maybe 105 contact tracers, when some research shows that should be closer to maybe 1,600. Should that be updated for a more realistic goal for what we're experiencing now? Thank you.
Thanks, Ian. So the 19.5 was the positivity rate for the past 24 hours. And Dr. Jahangir will come up and respond to your other question. Thank you.
Thank you. Regarding your contact tracing question, listen, I don't think anyone should stand up here or anywhere and tell you, yeah, we're where we need to be. But here's the thing: when we were having 100, 200 cases a day, 125 public health investigators is keeping up with the work, right? But now, as the case volumes increase tremendously, the work's increasing tremendously. And so what I'll tell you, what the public health department has done, and Dr. Caldwell and his leadership has done, is they have quickly hired additional 20. So it's, 140, 150 people, plus all hands on deck. So Dr. Caldwell has directed any of his staff that is available to assist with that to assist. Additionally, that group is looking at ways to employ technology and looking at other ways that we can keep up with the number of cases. I mean, so yes, to your question, yes, we need to continue working on updating that. I think that the speed that this is going, we're doing our best to try to keep up with it, and we're making changes hopefully very soon. So thank you.
Nancy Amons at the VUSMV, you're on the air.
Hi, thank you. I have 4 questions today. What is the turnaround time now on tests? When someone is tested, how long before you know the results? My second question is, how is Nashville now enforcing its mask ordinance? Are you writing tickets now? My third question for Dr. Alex Jahangir is the positivity rate. I thought I heard him say 18%. 111 cases now per 100,000, higher than the state of Florida. I'd like to hear his additional comments on that. And my fourth question is unrelated, and it's for the mayor. I'd like to hear the mayor's reaction to the fact that Wilson County is now competing for the state fair. Thank you.
Thank you, Nancy. Dr. Jahangir.
Sure. Thank you, Nancy. So I'll take 2 of the questions. Turnaround time. We changed our lab. That was our community assessment centers we're using because we were having longer turnaround time than I'd like. This new lab we're using, some results are back as early as 2 days, but on average 3.5 days, I believe, if you're looking at the tens of thousands of tests. Regarding the positivity rate, you're right. So we tested 14,816 Nashvillians last week. And out of that 14,816 residents, 18% of them were positive. So it gives me a lot of pause. It gives me a lot of concern because as we're testing more, and we are testing more, you would hope that positivity rate would go down because we're testing more people that don't have it and the virus is stable. But the virus is continuing to be rampant in our community. This is why we're talking about needing mask orders, pulling back on some of what was opening. This is why a regional response and a state response to enforce mask orders and to put mask orders in place matters, right? So we're doing everything we can as a municipality to fight this virus, but it is going up. There is still 10.5%, I just checked the numbers a minute ago, of people age 65 and older in Nashville who get this disease. So 10.5% of people who get this virus who are over 65 die. That's about 100, in fact, I'm gonna give you the exact number, excuse me. That is 1,009 Nashvillians over 65 had this virus. 106 of them have died. 10.5%. It's not a small number, and it's concerning. So I'm concerned that the positivity rate is going up. That's why we are doing everything we're trying to do as a city to fight it. And I think this is why we need a regional and a state and maybe a national response. Thank you.
Yes, good morning. On mask enforcement, The health department has issued now 48 civil warrants to businesses that for employees that we found out of compliance with the mask ordinance. We're reaching out to Metro Public, the police department, to find out numbers on the amount of citations they may have issued. We don't have those numbers right now. Thank you.
Thank you, Nancy, for the question about the state fair. It's a wonderful thing to think about such an event. Unfortunately, it is canceled for this year. I'm not surprised that Williamson County would be interested. I think any county should be interested in state fair. I think it is going to be up to the State Fair Commission where it's going to be held. Just a special plea, I think the home of country music should have the state fair. We should be able to do it. We need to value all the skills and crafts that come in for display at the state fair, not only the rides, the amusement, the entertainment, and the food, but to celebrate all the crafts that any good state fair brings to public attention. And I hope it stays in Nashville. And again, we have a year to get busy on hoping to keep it.
Julia Palazzo at WKRN.
Good morning. Thanks so much. A few questions for you guys. Dr. Jahangir, are there still preparations underway for an alternative hospital in Nashville due to the increase of cases? Also for you, I spoke with a man who has been diagnosed with COVID-19 twice now here in Nashville. He's currently fighting it for a second time. Can you talk more about, I know that Dr. Hildreth has talked about this before, but more recent update, more about what you know about this and the research being done, looking into the possibility of someone getting the virus a second time. And I'm also not sure if you can answer this question or someone else there. How is COVID-19 impacting kids here in Tennessee? Do we know how many cases are possibly linked to child care facilities in Nashville? Thank you.
Thank you, Julia. Dr. Jahangir.
Thank you, Julia. The alternative care site at Nashville General, I toured it with Dr. Caldwell just last week. It is ready. It needs staffing, and again, that is run by the state of Tennessee. So I toured it with Deputy Commissioner of Health, and she and I speak almost daily regarding if and when it needs to be activated. I speak daily, including this morning already with our hospital CEOs. We watch it very closely. I'm very happy right now. That doesn't seem to be a need, but I'm not taking it lightly because I think hospitalizations and mortality are a lagging indicator, right? So we're having 771 cases that we're reporting today. There's a chance that 771 may get sick in a week or 2 weeks. So we're very diligent about it. We have a call with all the hospital CEOs and the state later this week. But right now it doesn't need to be activated, but yes, it is ready to go, and it's pretty amazing looking. So that's that. Regarding diagnosis, somebody being diagnosed twice, I have heard a few things about that very recently. I think research is still looking to see, is it because the immunity goes away? Is it because the virus becomes dormant and it reactivates? So I use examples of shingles. So people like chickenpox, the virus goes away or becomes dormant and then activates later and they develop shingles. People have cold sores, is a type of herpes virus. Your cold sore gets better, you think you're recovered, and the virus activates. I think these are the things that we're trying to still know about this virus that people don't know. Regarding kids in Tennessee, I can tell you that 0% are child care facilities. So it appears 0.9% of cases in our region may have some relationship to a child care facility. So it's not zero, but it's pretty darn close to zero. But I don't know the exact numbers beyond that, much less for the state. Again, if there's a positive thing about this virus is it doesn't seem to impact kids as bad as adults. Not to say it doesn't. I mean, there are some kids that develop inflammatory response, and so you should be careful with kids. But this virus has not impacted kids as greatly as perhaps other viruses. And Dr. Caldwell wants to add to that. Thank you.
Good morning. Yeah, I have been working with a couple of daycare centers to have them have a preparedness plan so that they can walk through if any one of the employees or children were to become positive, what would be their action plan. So there are at least 2 daycare centers that I'm aware of where there has been one employee that was positive, and they took that action plan and put it into place, and they were able to not have to close the entire facility. As for the numbers in Nashville, Davidson County for people from age 0 or 1 month old to 17, there have been 1,228 cases, and that is a minority of all the cases in Nashville, Davidson County. So it does impact children, and we also think that children could be a risk for spreading, but we're still learning about that.
Ian at the Tennessean, we're going to come back to you. I believe you had a question that went unanswered.
Thanks, Chris. Yeah, my question was, we're talking about the numbers not looking good right now, and Mayor Cooper had said that it doesn't indicate that we can leave modified phase 2. I mean, don't the numbers show that we should be considering moving back? What do we need to see in order to trigger a further regression? Thank you.
Okay. Dr. Jungir?
Thanks. I think what is a good point of clarification here is a modified phase 2. If you look at what we modified, the restaurant and bar situation is actually what we did in phase 1. I think moving forward, because we are getting information from our contact tracers. Now, I think the earlier part of your question was, yes, we're going to make them robust, but we are getting actual information about this virus. And so we can take more strategic decisions on what is causing us spikes or clusters and target those areas first to try to minimize the impact on our economy as much as possible, but also be the most effective in the decisions we make. So I think I really want people to kind of think a little differently about rollbacks and so forth, and to really think about, do we have the willingness to make the hard decisions around specific parts of our society that's causing this virus to go up? And I think we've demonstrated that, and I know Mayor Cooper continues to demonstrate that and is willing to make those decisions as needed. So thank you.
Harriet Wallace at Fox 17.
Good morning, everyone. My first question is, Nashville is a destination across the state, which we know. Some neighboring counties are not requiring masks. We're seeing a case surge across Middle Tennessee. Wanted to see if there is consideration about restricting travel to the Nashville area. And I have a couple other questions. My second question is, Mayor and Dr. Jahangir, you all have talked so much and pressed so much about wearing masks, yet the cases are spiking. If people are simply not complying or the masks are not as effective, what then is the alternative that you all are considering to try and reduce cases? My last question is, with the increase in cases and concerns about healthcare capacity, and now we see contact tracing, how close is Nashville to reverting to phase 1? I know we're in phase 2 now, but how close are we to going back to phase 1? Thank you.
Thanks, Harriet. Well, I think your last question, Dr. Jahangir addressed when it was asked by Ian at the Tennessean. But in terms of your first 2 questions, Dr. Jahangir will come up and address those.
Thank you, Harriet. The restricting travel, I think I mentioned this last week, and actually the Mayor and I discussed this more today, because I know, as I mentioned, the Mayor is willing to do whatever it needs to be done to keep our city safe. But as of right now, Nashville, remember, is a city that provides so much to our community. We provide education, healthcare, jobs. So the idea of restricting travel to Nashville right now is not on the table. But again, this is why a regional and maybe statewide or maybe national response to this virus is critical, because we want to keep our Nashvillians safe. But as of right now, travel restriction is not on the docket. The masks, to your point of what happens if masks aren't effective, I want to say I think we're going to start seeing the impact of people being compliant with masks over the next week or so. Yes, the mask order went about 2 weeks ago. Really about a week ago, I started personally, and I've, through other stories, seeing more compliance with mask wearing. So I really hope once you get through a life cycle of this virus, which is 14 days, you'll start seeing some impact. Also, same with the restrictions around bars and restaurants. I think we'll start seeing those impacts in a week or so from there. What we do beyond that is really, I can't give you a definitive answer, because I think we just have to explore in such real time what is causing our spikes, what behaviors, what science, and at that point, and whatever needs to happen to make our city safe, I think that's what will happen. So I know it's kind of a vague, broad answer, but the answer is really whatever it takes to make our city safe. So thank you. I'm sorry, Mayor.
Well, thank you, Harriet, for that question. I think, in listening to news reports last night, I think it would be that Tennesseans should maybe focus on this following thing, that if your county has enough cases that you cannot go and visit your loved ones at a nursing home, maybe your county should also have a face mask ordinance. That shows the relative level of cases, that threshold, which has been widely reported in the media over the last couple of days. Perhaps that also, again, should get people to support a deeper mask ordinance. And ultimately, we are not an island. Nashville is not an island, and we do need to have a regional response to this rather than simply transmitting cases in and out. So in terms of thinking about what is an appropriate requirement in the state, maybe that nursing home restrictions, which have been, I think, very effective compared to other states in limiting maybe some of the fatalities that might have happened in Tennessee. Maybe that metric also is something that we could build a more uniform masking ordinance around.
Our last question today is from Kara Hartnett at the Nashville Post.
Hi, thank you. Following up on the contact tracing, Mayor Cooper, do you have enough funding to hire the number of contact tracers needed to keep up with the virus currently? And then for Dr. Jahanger, we've seen big increases in cases and hospitalizations related to COVID, but bed availability has remained relatively stable. Why is that? And then how does the current situation we find ourselves in play out this fall or winter in hospitals with flu season and generally less availability? Could we sustain this level of growth then? And where does this position our healthcare system for the winter in the coming months?
Thank you, Kara. Mayor Cooper.
To go first here, Kara. Yes, I think we have the funding. It's very hard to scale up an operation of this size, particularly with the increase. It does, I want to put a plug in for people when they test positive. Don't avoid contact tracing calls. Spend the time on the phone. Be helpful in the contact tracing. We have thousands of people under quarantine right now who have tested positive. They are our best leads and our best clues. Now, we're going to have to scale up capacity in this regard. I do feel that Nashville is viewed within the state. I know I believe the health commissioner has pointed this out, is doing a very good job relatively. Probably not a perfect job, but it's hard once you've got thousands of individual contacts that you're trying to trace, and then each of those positive cases leads to many other calls. So we need people's help to get that done. Once they're quarantined, we need people to really comply with that. And we, of course, need to build additional capacity. But ultimately, having a regional system probably has a lot of merit, that we do have people going back and forth between counties, and we need all counties to respond equally. We basically have the same population spread across county lines. Hundreds of thousands of people come in to work and leave every day, to work, to school, to hospitals every day. And having a broader response, a coordinated response would be helpful.
Garrett, thank you for the question. So, so when we've seen an increase in hospitalizations, I think just to quantify that, we have, as I said, at 199 today, so let's say 200. About 10 days ago, maybe it was 130. So we are seeing an increase, but we're seeing that increase, it's not going from 130 to 600 or 700. So that is, I guess, if there's a positive to this, is the hospitalizations for COVID patients is going up slowly, but it is still going up. We have about, regionally, a little over 3,000 beds. So that includes Davidson County as well as surrounding counties. Davidson, I think, has about 2,000, maybe a few thousand more, a little over 2,000 beds. You know, as I mentioned earlier, we're being very diligent watching it. I think there are several levers that each hospital can pull to increase their own personal capacity. There are levers that the state can pull. And fortunately, none of those levers have really been pulled per se right now. So there's ways to increase capacity. The numbers we provide are where we are as status quo. But again, I don't want that to be perceived as we're not caring about it and it's not a big deal. I think it can very quickly turn, and that's why we are paying attention. And as you pointed out, as we enter the fall and the flu season, and that is something we have to really keep an eye on. So I guess the take-home message there is we are good right now. I feel very comfortable with the plan that is out there, but I wouldn't let down our guard. The other thing, if I can just add to the contact tracing question, which I think several of you all have, with our increased numbers, we still are able to. We have 80% of, or 79.5% of contact investigations are started within 1 day, and 75.8% of investigations are completed within 2 days. So I don't want people to think we're hitting like 0% or 10% of cases are contacted. And we still have 75% or 80% of cases contacted within the first day. Now, we would like that to be 80, 90, close to 100%. And as I said, there's things that our Colin and his team and the city are doing to make that better. But we are still reaching about 80% of people on the first day. But if you've had tested, if you're worried about the symptoms, please stay in and wait until your results. That's the thing with personal responsibility in this crisis matters. So thank you.
Thank you, everyone. I'd like to thank Ms. LaTanya Channel for joining us today. The next scheduled Metro COVID-19 press briefing will air on Thursday, July 16th at 9:30 a.m. Thank you for joining us. This concludes today's event.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.